Hello friends, welcome to Medical Guruji. I am Dr. Arun Kumar. Today our video is about liver cirrhosis, its definition, types, pathogenesis, stages, diagnosis, treatment and complications. What is liver cirrhosis? Cirrhosis is the advanced scarring or fibrosis of the liver which result from various liver diseases and the various conditions such as chronic hepatitis and prolonged alcohol abuse. There are types of cirrhosis based on the cause. First one is alcoholic liver cirrhosis. Second is hepatitis related cirrhosis. Then cryptogenic cirrhosis, autoimmune cirrhosis, and biliary cirrhosis. Let's discuss the pathogenesis of the cirrhosis. Liver cirrhosis is a multifactorial disease, means there are various causes of liver cirrhosis. Chronic liver injury response leading to the fibrosis. There are cell types which are involved in this cirrhosis: hepatocytes, Kupffer cells, hepatic stellate cells, and there is also role of cytokines and growth factor in fibrogenesis. We will discuss one by one. First one is chronic liver injury. This process begins with the sustained liver injury due to factors like chronic alcohol consumption, viral hepatitis like hepatitis B virus infection, hepatitis C virus infection, and metabolic disorders. These factors lead to repeated episode of inflammation and cell death, which cause necrosis, and ultimately it cause fibrosis. Second is activation of hepatic stellate cells. Liver injury activates the HSCs, that is hepatic stellate cells, which are normally inactive, means in quiescent phase. After activation, these cells transform into myofibroblast-like cells that produce extracellular matrix ECM components like collagen. Then fibrogenesis occur, that is activated HSCs secrete large amount of collagen and other extracellular matrix proteins, leading to formation of fibrous band. The excessive deposition disrupts the normal architecture of liver, which result in creating of fibrotic septa and regenerative nodules. Then role of cytokines and growth factors. Inflammatory cytokines like TGF-beta, PDGF, and growth factors are released by various cells, including Kupffer cells that are liver macrophages. These molecules further activates HSCs and promote ECM production. Fifth one is hepatocyte regeneration and death. Despite ongoing injury, the liver attempt to regenerate. Hepatocyte proliferate, but chronic damage impairs the regenerative process. Repeated cycles of hepatocyte death, that is apoptosis and necrosis, and regeneration lead to nodular formation typical of cirrhosis. Vascular changes and portal hypertension. Fibrosis and nodular regeneration alter the vascular architecture, which disrupt the blood flow. Increase the resistance to blood flow leads to portal hypertension, causing complications like variceal bleeding, ascites, and splenomegaly. Progression to decompensated cirrhosis. Initially, liver can compensate the damage, that is compensated cirrhosis, over the time. As fibrosis progresses, the liver function declines. Decompensated cirrhosis occurs, which is marked by severe complications like jaundice, encephalopathy, and liver failure. There are 4 stages of liver cirrhosis. We will discuss one by one. Liver cirrhosis progress through various stages, each with varying degree of liver damage and associated symptoms. So first stage is compensated cirrhosis or early stage. It is characterized by minimal liver damage with no significant symptoms. Liver still perform its function adequately despite the presence of fibrosis. Symptoms: the patients are often asymptomatic, but some patients may experience mild fatigue or a feeling of weakness. Complications of first stages are minimal with no signs of liver failure or portal hypertension. Next is stage 2, that is compensated cirrhosis with varices. It is characterized by presence of esophageal or gastric varices due to portal hypertension. Liver function are still relatively preserved. Patient still asymptomatic or have mild symptoms. Complications are like development of varices increase the risk of variceal bleeding, which lead to anemia. Decompensated cirrhosis or advanced stage, that is stage 3. It is characterized by significant liver damage with impaired liver function. Liver ability to perform its function is reduced. Symptoms like jaundice, ascites, that is fluid accumulation in the abdomen. You can find the video link in the I button. Hepatic encephalopathy, that is characterized by confusion and altered consciousness and significant fatigue. High risk of complications such as variceal bleeding, spontaneous bacterial peritonitis, hepatorenal syndrome, and hepatocellular carcinoma are complications of this stage. Then last stage 4 is end stage liver disease, ESLD. It is characterized by severe liver damage with marked liver failure. Liver function are critically impaired and liver cannot sustain life without medical intervention. Symptoms are persistent and severe. These include jaundice, ascites, hepatic encephalopathy, and muscle wasting. Patients are at high risk of life-threatening complications which require liver transplantation for the survival. Now, generalized signs and symptoms of liver cirrhosis are early signs include fatigue, weakness, weight loss, and advanced symptoms like jaundice, ascites, and hepatic encephalopathy. Physical findings like spider angiomata, Palmer erythema, gynecomastia, hepatomegaly, and splenomegaly. Moving on to diagnosis. So, we will discuss one by one in details. So, first part is clinical evaluation, that is by history and physical examination. In history, we assess the risk factors such as alcohol consumption, viral hepatitis, metabolic disorders, family history, and drug use. Look for symptoms, that is fatigue, jaundice, abdominal swelling, confusion, and gastrointestinal bleeding. Then observe the signs like spider angiomata, Palmer erythema, gynecomastia, hepatomegaly, splenomegaly, and ascites. Then we have to perform some laboratory tests. First one is liver function test, that is LFT. In LFT, we get elevated liver enzymes like AST and ALT, which suggest hepatocellular injury, increased level of bilirubin, and elevated alkaline phosphatase and gamma glutamyl transpeptidase. This suggests cholestasis. Next finding is decreased albumin, and another is prolonged prothrombin time, which suggests coagulation abnormality due to liver dysfunction. We have created a separate video on LFT. You can click on the I button and watch the video for detailed interpretation of LFT. Next is CBC, that is complete blood count, to rule out the anemia, leukopenia, thrombocytopenia, which can be seen due to hypersplenism or bone marrow suppression. Then there are some serologic tests like screening of viral hepatitis, hepatitis B virus, HCV, and autoimmune markers like ANA, AMA in the suspected cases of autoimmune hepatitis or primary biliary cholangitis. Then we also have to do some special tests like iron studies to rule out the hemochromatosis, copper and ceruloplasmin levels for ruling out Wilson disease, alpha fetoproteins levels to rule out the hepatocellular carcinoma. Then in the radiologic evidences, we order ultrasound, which is initial imaging modality to assess liver size, texture, and presence of nodules, and also can detect ascites and splenomegaly. Then we perform computed tomography scans, that is CT scan, which provide detailed imaging of liver architecture and help in detect the hepatocellular carcinoma and portal hypertension. MRI is superior for characterizing liver lesions. MR elastography can assess liver stiffness and quantify the fibrosis. Next is transient elastography, that is also known as fibroscan. It is a non-invasive method to measure liver stiffness as an indicator of fibrosis. The next diagnostic method is by liver biopsy. Liver biopsy is indicated when the diagnosis is not certain and to assess the fibrotic stage of the liver and to rule out other liver pathologies. This involves obtaining a small sample of liver tissue through a needle, that is by a biopsy needle. Sample is subjected for histological examination, which confirm the presence of fibrosis and cirrhosis and identify the etiology, that is alcoholic liver disease, viral hepatitis, non-alcoholic fulminant liver disease, fatty liver disease, etc. Then another methods are endoscopic procedures, that is esophagogastroduodenoscopy EGD is performed to evaluate for esophageal and gastric varices due to portal hypertension. Next is colonoscopy, which may be indicated to assess the portal hypertensive colopathy. Other diagnostic modalities like serum biomarkers, emerging tests like fibrotest, and enhanced liver fibrosis ELF test to evaluate fibrosis. Another diagnostic test to quantitative liver function test, which assess the specific liver functions like indocyanine green, that is ICG clearance. Now moving on to the treatment part. The first one is non-pharmacologic treatment, includes the lifestyle modifications. First is cessation of alcohol. Complete abstinence from alcohol is crucial as it prevents further liver damage. Then second is changing the diet. A balanced diet rich in fruits, vegetables, and lean proteins. Salt intake should be limited to less than 2 grams per day to prevent fluid accumulation. Then weight management. Maintaining a healthy weight through diet and exercise can help in managing complications like fatty liver disease. Second part is medical management. Diuretics are first to reduce the fluid retention and manage ascites. Then beta blocker to lower the portal hypertension and also reduce the risk of variceal bleeding. Antiviral therapy for patients with viral hepatitis HBV HCV to reduce the inflammation and prevent progression. Lactulose and rifaximin to manage hepatic encephalopathy by reducing the ammonia level in the blood. Antibiotic for infections like spontaneous bacterial peritonitis. Monitoring and follow-up are necessary. Regular assessment are done, that is by frequent monitoring of liver function test, imaging studies and clinical evaluation to track disease progression and manage complication. Screening for complication like hepatocellular carcinoma using imaging and serum alpha fetoprotein levels, AFP levels. Next part is surgical intervention. Liver transplantation is indicated for patient with end-stage liver disease or decompensated cirrhosis. It involves replacing a diseased liver with a healthy donor liver. Shunt surgery. Procedures like transjugular intrahepatic portosystemic shunt tips to reduce portal hypertension and manage complications like variceal bleeding. There are some preventive measures like vaccination. Patient with cirrhosis should receive vaccination against the hepatitis A, B, pneumococcal infections and annual flu shots to prevent infections. Avoiding hepatotoxic substances like NSAIDs, which can further damage the liver, and certain herbal supplements, which also cause hepatic toxicity. Then palliative care for the patients with advanced cirrhosis. Palliative care help in managing the symptoms and improve the quality of life. Psychosocial support, counseling and support groups for patients and their families to cope with the emotional and psychological impact of the disease. There are numerous complications of liver cirrhosis. First one is portal hypertension, that is increased blood pressure in the portal vein due to liver scarring, which can lead to variceal bleeding, splenomegaly and ascites. Second is esophageal and gastric varices. These are the enlarged vein in the esophagus and stomach that can rupture and cause life-threatening bleeding. Third one is ascites, that is accumulation of the fluid in the abdomen due to increased pressure in the portal vein and decreased albumin production. Fourth is hepatic encephalopathy, brain dysfunction caused by accumulation of toxins such as ammonia that the liver can no longer detoxify. Symptoms range from confusion to coma. Fifth one is spontaneous bacterial peritonitis, infection of the ascitic fluid which can lead to severe abdominal pain, fever and worsening of liver function. Sixth is hepatorenal syndrome, kidney failure that occur in advanced liver disease due to alteration in blood flow and kidney function. Seventh is hepatopulmonary syndrome, pulmonary vascular changes leading to shortness of breath and low oxygen levels in the blood. Eighth is coagulopathy, impaired blood clotting due to reduced production of clotting factors by the liver, increase the risk of bleeding. 9 is jaundice, yellowing of the skin and eyes due to buildup of bilirubin, a byproduct of RBC breakdown that the liver can't process. 10th is malnutrition, poor absorption of nutrients due to reduced liver function and gastrointestinal complications. 11th is liver cancer, that is hepatocellular carcinoma, increased risk of developing liver cancer, particularly in patients with chronic viral hepatitis or advanced cirrhosis. 12th is gallstones, formation of stone in the gallbladder due to altered bile composition and flow. 13th is bone disease, that is osteoporosis or osteopenia due to impaired absorption of vitamin D and calcium. 14th is electrolyte imbalances in sodium, potassium and other electrolytes due to impaired kidney function and diuretic use. And last is fatigue and muscle wasting, that is due to chronic fatigue and muscle loss, that is sarcopenia, due to reduced liver function and malnutrition. In conclusion, liver cirrhosis is a late-stage liver disease characterized by permanent scarring or fibrosis that replace healthy liver tissue. The scarring disrupts normal liver function, leading to a decline in liver ability to process nutrients, filter blood, and detoxify harmful substances. Common causes include chronic alcohol abuse, viral hepatitis B and C, and non-alcoholic fatty liver disease (NAFLD). Symptoms often appear in advanced stages and may include fatigue, jaundice, easy bruising, swelling in the legs and abdomen, and confusion. Treatment focus on managing the underlying cause, preventing further liver damage, and addressing the complications. In severe cases, liver transplant may be necessary. Thanks for watching. If you understand this topic, don't forget to hit the like button and subscribe to our channel Medical Guruji for more content. Share your thoughts in comments below. Until next time, take care and stay curious.